This is an albeit truncated, real inflatable implant. What's up guys, Dr. Alex Tatem here, and welcome back to Hard Facts Episode 4. This is our series where we focus on ED, penile implants, and everything else related to the penis. Today we're going to answer the question, what does the penile implant look like? This is a common question that I get from men in my practice who are considering implant placement. Now, men who are asking this question are usually asking one of two different things. Most men are in reality asking, Doc, what am I going to look like with an implant? Am I going to look different or weird? Is my partner going to notice anything? For those men, the answer is pretty darn simple. You're going to look like you, and your penis is going to look like your penis. The implant isn't going to look or feel like something foreign when it's erect. It truly looks like a normal erection, and over 95 to 98% of patients and their partners absolutely love it. Now, some quick caveats. I tell patients that their penis post-implant will generally look like their penis now, but that means we're talking about what their penis looks like today, not what it looked like with an erection 5 years ago. Men lose an average of 1 to 2 inches for every year they live with ED until getting their implant, and most men's final erect length with an implant is less than what they remember, but this loss of length is not caused by the implant. In fact, the implant is the only thing that prevents more loss, so if you care about the size of your penis, the sooner you get an implant, the better. Now, depending on your anatomy and your device, you may be able to tell that someone has an implant when they're in the flaccid state, but you'd have to get pretty close to do so. Some men may notice folds in their device where the penis bends, and they may notice the cylinders inside the penis. In the business, we call these dog ears, and it's akin to folding a garden hose in two. There's going to be a slight angle where the penis bends. Most men aren't bothered by these once they know what they are, and most of these will straighten out with just 1 or 2 extra pumps in the device. Some men can be anxious about this, and I just try to reassure them that our job is to shoot for a functional, penetrating erection that they can use for sex. Not to be flippant about it, but unless you're a nudist, most men are not trying to show off their flaccid penis. So to answer the first question is pretty straightforward. Men with an erection from an implant look just like men with an erection and no implant. The second thing men might be asking is, what does the device itself actually look like? These men are usually my engineers or fellow surgeons who want to see the device itself to try and get their heads wrapped around it, which is totally reasonable. So this is it. This is an albeit truncated, real inflatable implant. If you'll remember from our previous episodes, the male erection is made up of 2 inflatable tubes called the corpora. During surgery, we measure these and slide our own specifically sized inflatable cylinders inside them. These 2 cylinders are then connected to a pump that we place down into the scrotum where men can access and operate their device. When men squeeze the pump, it moves saline, aka salt water, from a tank of fluid we hide in the abdomen. We've removed the reservoir from this device because frankly it's just too much to hold at once, and the reservoir isn't something most men will ever see or feel. Worrying about that is my job, not yours. And when men are done with sex, all they need to do is squeeze the mechanism on top of the pump and then gently squeeze the cylinders to return the saline back to the reservoir so it can be used again. It's a totally closed system that never needs refilling or refreshing. So that is what the penile implant looks like. I hope this dispels some of the mystery surrounding the implant. It can look a little odd outside the body, but as I often remind my patients, think about a hip or a knee replacement. Those things look terrifying outside the body, but when they're placed by a dedicated surgeon, they're invisible with fantastic long-term outcomes, just like the penile implant. So that's it for Hard Facts Episode 4. If you like what we do here and you want to see more, click that like and subscribe button, ring the notification bell, and leave your questions in the comments down below. We're starting to collect these questions from patients to help make future episodes, so get yours in now. Until then, this is Dr. Alex Tatem, signing off.